Yes, hello, good afternoon to all. Yes, welcome everyone. Thank you for joining our Facebook Live on every Wednesday, 1 to 2 p.m. Yes, today we will be talking about a very interesting topic called NK cell therapy, which is one of our latest immunotherapy treatment. Very beneficial to boost our immune system. If you are looking forward to prevent your health aging, for aging prevention, to prevent diseases from cancers, and also if you are looking for treatment that can effectively treat diseases like cancers and autoimmune diseases. Yes, NK cell is something that you need to know and probably the good options that you can consider. Yeah. So thank you everyone again. Welcome everyone to our Facebook Live today. I'm Dr. Jeff from Revival Clinic. Yes. So I'm very happy here to be able to share with you all, all the knowledge and informations regarding a lot of anti-aging and a lot of knowledge how to make yourself healthy and beautiful. Okay, so today's topic actually was discussed in ATV in Malaysia yesterday, in a live show in ATV yesterday, in the Mandarin version. So every one of you, if you are interested or if you are looking for a Mandarin version about NK cell therapy, yes, you can visit YouTube. You can watch back the replay in YouTube, and later on I will get my assistant to put a link at the comments so that you can actually also click the link and also review the replay in the YouTube. Yes, today we will be talking about NK cell, but in the English version, so that I believe more friends like our Malays, Indian, or even all English at friends, probably you are more understand or you'll be able to get the information better in the English version. And of course, throughout the topic discussion today, I welcome every one of you to ask questions in between. I will try to answer all your questions if possible. Let us talk about NK cell therapy. Probably a lot of people have not ever heard about NK cell. So NK cell stand for natural killer cell. Okay, let me type it out. What is natural killer cell? NK cell is natural killer cell. Okay, NK stand for natural killer. Okay, so let us begin. Okay, before we talk about NK cell, let's talk about immune system. Okay, why? Because NK cell is a part of immune system. So let's understand a very basic fundamental idea or principles of immune system. In our immune system, it's actually divided into two kinds of immune system. Either we call it innate, means you born with it and naturally you have that kind of immune system or immune ability. Another kind of immune system called adaptive immune system. So it's actually the difference between these two is innate immune system is where your body own the capability by itself, yeah, since born. So it acts as a first line of defense that helps you to eliminate all the pathogens or all the damaged cells, virus, infections in your body without any needs of previous learning or activation. On another hand, adaptive immune system is a learned, or we call it second line defense mechanism of our body to eliminate pathogen after being activated. Meaning to say we have to learn or we have to get a first line, the innate immune system as a first line to act first. Then after that, it will sort of like coordinate and activate the second line of defense system to eliminate further on the pathogen. So this is the difference between first line and second line, innate and adaptive immune system. So our human immune system go in this way, such a way. So, okay, a better idea by giving you an illustrative picture. So it starts as a innate system here. Okay, so I enlarge it and for you all to see. Innate immune system is start here, where you can see there is some we call it innate cells, including NK cell, which is part of a category here. So it acts and respond to all those pathogen, damaged cells, virus, and after that it will start activating the adaptive immune system through a breaching effect. we call it NK T cell. Yeah, so this is part of a mechanism how NK cells play the role in the immune system. NK cell is cells that acts as an innate immune system frontliner, and also it works as a breaching activation to activate our adaptive second line immune system. All right, so as simple as that. All right, so immune system works to defend our body. Yes, it is not only immune system is not only to defend external coming infections like virus, any bacteria, yeah, but also it helps us to clear all the internal, yeah, damaged cells, aging cells, or any damaged sort of like pathogens, yeah, in our body. Okay, so that's why immune system is very important to prevent a lot of diseases. And indeed, nowadays, more and more evidence shows that a lot of diseases, including cancers, yeah, autoimmune disease, are related to immune system derangement. Okay, yeah. So let's talk about NK cell a little bit. Okay, so all the immune system cells in our body, either innate or adaptive, yeah, it comes from the blood. It's part of the blood. It comes from the bone marrow. Yeah. So it also can come from spleen, livers, things like that, or thymus. But majority coming from bone marrow, which is the first place where our body create and produce this kind of blood cells. And one of the component of blood cell called white blood cells. So white blood cells, yeah, it can be divided in several different kind like neutrophils, mast cell, eosinophils, yeah, all this, and including natural killer cell, NK cells. Okay, and these NK cells, yeah, when it's responding to any pathogens or infections or any damaged cells, it will activate the natural killer cells to activate the secondary defense system called adaptive defense system. And our adaptive defense system has these T cells and also B cells. I believe every one of you probably heard about T cells and B cells, and then B cells will produce the antibody. Yes, so how you get your antibody is by this mechanism of NK cell, NK T cell to stimulate the adaptive immune system. Then the B cells will produce, and then the B cell will start acting and producing antibody. All right. So this is how it goes. Let's see. Immune system is actually okay. Just get a simple idea, right? Okay. So now you know where is the position of NK cell. It's actually part of the innate, or first line immune system. So actually, our body do have NK cell, but why there are never information or talking about NK cell? Indeed, because we already have that kind of immune system since born. Yeah. So there's no any particular issue or that people are talking about NK cell until recently that a lot of scientists found, yeah, more than 50, 60 year studies has been established, and recently more and more people paying attention on NK cell, yeah, and people starting to notice that NK cell is playing a very, very important role, especially for our immune system mechanism, and also in terms of cancer treatment and cancer prevention. Why? Okay, a very simple idea for you all to understand, yeah. Our cells will definitely age when we are aging, or even when you are not aging yet, but if you do have a lot of stresses or pollutions, yeah, your cells, your body cells actually will age faster, yeah, than your age. So when the cells getting aging, the cells will slow down in the replication ability, and at the end of the day, it will become a senescent cell or aging cell. So this aging cell will not able to reproduce or regenerate anymore, but it will just stays there in our body. And if it is staying just silently, then it's fine. But most of a senescent cell or aging cell will stay in our body and will start producing toxics. And this toxic production will causes our body to accumulate inflammation. And also this senescent or aging cells, which is useless, it will have a risk or chance to turn into cancer cells if the inflammation level in our body accumulates. So this is where the NK cells play the role. It actually will identify this kind of senescent or dead cells and will start eating up and create it out from our body system. Okay, so this is how NK cell works. Not only to defend external coming, but also to defend internal system. All right. So people realizing the important role of NK cell and starting to pay more and more studies, attention, and understanding about NK cells, and it start to show the benefits of NK cells in terms of our body preventions from a lot of diseases, majority from immune system diseases, autoimmune diseases, as well as cancers diseases. Okay, so basically for your illustration, okay, for you to understand a little bit about NK cell, okay, so NK cell usually stay in our body mostly in an inactivated cells form. Okay, so once it detects, without any activations, it itself has the inborn ability to detect any virus infected cells or any damaged cells or any aging cells, and it will start acting directly. It will kill any abnormal cells, for example, any tumor cells or cancer cell or virus infected cells, or indirect way, it will actually activate our immune system to create antibodies or T cells, to start to protect our body and learn the ability to protect our body. Okay, so this is how the NK cell play their role in our immune system. Very important and very crucial. And one of the important facts that scientists found is our body's NK cell will actually age and slowly deplete in number, or means decreasing in number when we age. Usually it starts by about 40 to 40 years old and above. And even that is the fact, but the thing is, there are people who done their blood test, even though they are like in a more advanced age, even they are like about 50 or 60 years old, they probably found their NK cell level or number in the body still on a high level. Okay, the answer here is it doesn't mean your NK cells is available in your body, means your NK cell functions is there. Okay, most of the time our body, yes, it will reduce in number, but even though your body remain high in number of NK cell, most of the time the NK cell itself is a non-functioning NK cell, and most of the time the percentage of NK cell which is active and non-active will also change with age. And when we age, most of the time the percentage of non-active NK cell will become more. All right, so when the cells is non-active, it is actually not functioning. It's useless, so it's not carrying out all the killing effect or the sort of like antibody the anti-cancers effect. All right, so NK cells actually, this is the fact that a lot of people now realize, a lot of scientists and medical scientists realize that NK cells play important role, but even though our number is there, but it is not functioning and not activated form. That's why our immune system will drop, and the risk of cancers, autoimmune diseases will starting to climb up. So this is the reason why. Okay, so just now if you see my presentation a little bit in detail, okay, NK cell is stays as a primitive of a first line, okay, immune system. But once the NK cell detecting, okay, the abnormal cells or infected cells, and it would starting to change into NK T cells, which is a kind of NK cell also, but it has a role or function as an NK cell as well as T cells, and it works as a breaching. Breaching means it start to coordinate the innate response to adaptive response. All right. So here with the explanation, okay. So you see, NKT cell actually breaching innate and adaptive immune system. It's sharing both physical and functional characteristic of CK cell, NK cell and T cell. And the activated NK T cells produce large quantity of cytokines to help differentiation and maturation of other immune cells, which activates T cells and B cells. And B cell produce antibody. T cells will produce a lot of cytotoxic, or meaning to say it will also damage all the infected cells. Okay, so NKT is very important. I emphasize here because one of the findings shows that a lot of autoimmune diseases and cancers are related to decrease in the function of NKT cells. So this is how now the angles of treatment onto these cancers and also autoimmune diseases are starting to pay attention on NK and NKT cells therapy. Okay, all right, so now we roughly got an idea what is NK and NKT cells. Okay, ladies and gentlemen, if you are not sure or if you are having a lot of questions in your mind, please type it out in our comment. I will answer one by one if possible. All right, so now if you understand or at least get a very fundamental basic rough idea what is our immune system, what is NK cells role in our immune system, then you will start realizing, NK cell is actually inborn there and is very important. And nowadays, because of the proof and evidence base shows that NK cells and NKT cells are playing a very important role in cancers and autoimmune diseases. Now, a lot of treatment on cancers and autoimmune diseases are also trying to combine NK and NKT cells as part of the way to treat these kind of diseases into a more effective way. Okay, so ladies and gentlemen, okay, if you're talking about NKT cell, okay, most of the time, our body needs NK cell in optimum level, means you have a high level of NK and NKT cell, and also your NK and NKT cells should be in the activated forms. But the thing is, when we get older, the number may decrease, or may activation of the NK and NKT cell will decrease also, so become less active. So how to make our body increase in on the number and also the percentage of activated NK cell? One of the way is by doing this NK cell therapies, which is transplantation. Okay, but the thing is, this transplantation is not from other people. Even though I written here, it can be autogenic and allogenic, but the best way is still recommended is still using autogenic, means your own body NK cell. Okay, so later on I will explain a little bit more on how it is done. Okay, yeah, and some of our audience already asking, Judy Tan is asking, safe or not? Okay, I will explain on how it is, the technology, then you understand. Yeah, basically it is safe, yeah, and anyone also can do, healthy person also can do, or any people who have cancers problem or autoimmune diseases or any family history of cancers also can do it to prevent cancers risk also. All right, okay, so let's talk about NK cells and how it is done. Okay, one of the famous NK cells available, or NK cell technology available in Malaysia is from a Korea, and is patented in Korea and also Japan, FDA approved, called MYJ1633. Okay, so this is part of NK cell technology available in Malaysia. We are so lucky. Okay, NK cells usually how it's done is actually just need to take your own blood. Yeah, very simple. Okay, no need to go and do surgery, whatever. No, no, no. Okay, you just need to take part of your blood, and you just need to wait at least 14 hours after the blood is taken. It will send to the lab, and the lab will have technologies to cultivate. Yeah, and once the NK cells is extracted, purified, and cultivated, it will also get activated. So this is part of the patented technology of this Korean technology called MYJ1633. So it will be able to expand the numbers of NK cells, yeah, even up to almost 200 to 5,000 times, and also the activated form will be also increased at least 8 to 10 times. Okay, so this is the uniqueness of this technology. Okay, so it has a very good mixture of NK and NKT, because we want NK cell function, and also we want NKT to help us to activate the secondary or adaptive immune system. So our immune system in the whole length of treatment will be taking place into helping our body to fight against all the infections or a lot of diseases. So that's why, okay, so NK cell, we want it to be a good quality, then we will need to have a good mixture of NK and NKT cell, and also high number of NK and NKT cell. Okay, and also high toxicity, means the cells is highly activated and able to kill all the damaged unhealthy cells or even the virus infected cells. Okay, yes, yeah, some people may asking me, hey, is it able to treat COVID-19 cases? Yes, NK cells is able to treat all the virus infected cells, including COVID-19 infected cells, so to improve your immune system and to prevent diseases from NK cells. Yeah, so part of the audience. Oh, so yes, yeah, thank you. Okay, all right. So NK cells, yeah, we need some technology like this so that it has the ability to help our body. Okay, so I'm talking about this because we want some good technology of NK cells so that it serves the purpose that we want. Okay, so we also want the NK cell to be highly activated, means the cells is high in number, high in function, and also good proportion. It works in the whole range of immune system, meaning to say you have a mixture of NK and NKT cell. So this is what we are looking for as a medical doctor to help our patient to treat. So if you are looking for good NK cells, yeah, this is part of a technology now that available in Malaysia. Yeah. So okay, who needs NK cell? Yeah. So now you have a rough idea. Okay, you know that our immune system is one of the important health aspect that we need to pay attention to. And this health aspect of immune system do contribute or even related to a lot of diseases, yeah, or is one of the causative factors or main cause to have cancers and autoimmune diseases. So we know all these are related. So nowadays we realize if you want to prevent your health, you want to prevent aging, we also we should is not we also we should now realize and understand that immune system is part of our considered organ in our body that we should take care of. It's not that, oh, I take care of my heart, I take care of my liver, I take care of my guts, yeah, I take care of my skin, I take care of my eyes. You should take care of your immune system as well in such a way. Yeah. So how to take care of your immune system? So one of the way that you can do called NK cell therapy. Yeah. So if you are looking to improve your body in the sense, let's say if you are a healthy person, for the sake of prevention, yeah, to boost your immune system, if you are likely to travel very frequently and for the next near future, at least I would say 2 or 3 years, we are still very scared and anxious about COVID-19, even though we are fully vaccinated. But who knows, your vaccine level or your vaccine antibody level will also drop over time. Yeah, maybe 6 months, 9 months. So we need a booster. But in need of a booster, probably you can also use NK cell therapy to boost your immune system. Yeah. And also, if you are looking to prevent aging, meaning to say you want to prevent your heart aging, your brain aging, your internal organs aging. Yeah. So NK cells actually helps in aging. Why? How? Because NK cells help to eat up, clear off all the unhealthy cells in the body. Then it will let your organs to stay healthy without all the cells or aging cells that stays there and producing a lot of toxics to your body. Okay. Yes. Amni Randan said, is it safe for senior citizen? Yes, of course. So when we age, senior citizen is the group that when they age, they are having a lot of unhealthy cells in the body. They need these NK cells to clear off for them. And because when we age, our body will have lacking of good quality of NK cells and we are lacking of active NK cells. So this is why older person is even more needful of this NK cell therapy. Okay. If you have a strong family history of cancers, as a prevention, you also can do NK cells to improve your immune system and to have a better confidence level of cancer's prevention rather than just taking supplement by your no, you are not sure whether those treatment or those supplement whether really it works or not. All right. And also persistent high tumor markers. Yes, I did come across a lot of friends, relatives, or even patients. They do have some persistent high tumor markers in their routine regular blood checkup, but they do not really able to detect any definite cancers in the body. So this brings a lot of anxious and also a lot of worries in patients in general pool. So actually, these high tumor markers could be probably some inflammation response due to old cells or aging cells in the body, or they are possibly a very early stage of cancer cells which hidden there but has not really shows any obvious characters. So you can't even detect it. So in this sense, NK cell is the choice of options that you can really do and to kills off all these unhealthy cells in our body, and it will help you to reduce all the tumor markers, right? Yes. So as a treatment basis, beside for prevention basis, as a treatment basis, for any cancers, in all stages, there is still possibility to combine, I would say, or combine NK cell as part of our treatment progress. Meaning to say, you can combine with your radiotherapy, your chemotherapy, your surgery to improve a person's with cancers, to heal better, faster, and also to prevent relapses in the future. Yeah. And also in autoimmune diseases like SLE, like rheumatoid arthritis, psoriasis, vitiligo diseases. Okay, so a lot of these multiple sclerosis diseases. So all these are autoimmune diseases. So NK cells play a very functional, important, effective role into treatment on this. And even some of the studies shows NK cell alone also effective to take care and also to improve the autoimmune disease without any needs of medication. Yeah. Immunodeficiency like HIV cases, yeah, infectious diseases post COVID-19 syndrome or hepatitis B, hepatitis C patients or carrier, yeah, also needs NK cell because it helps a person to clear off all the unhealthy cells or all the infected cells so that it can prevent all the cancer's changes and also inflammation, silent inflammation in the body. Okay. So you see how important and how functional NK cell. Yeah, we do not have any technology before this until only recently that Malaysia had this technology established, and we are so thankful that now we are able to realize our dream of doing this kind of treatment NK cell to boost our immune system in the effective way. Okay, so the main benefits, yeah, it can come from cancer treatment or cancer prevention. It can also use to prevent our immune system deficiency, means to boost our immune system. And a lot of people do it as anti-aging. They want to prevent diseases. Yeah? They want to prevent cancers in their genetics, because they have some family history. So this is the thing that a lot of people can consider from different purposes, and it is basically considered safe to do for everyone, suitable to do for everyone. Okay, here I managed to get some studies which using NK cells to share with you all. One of a case study here is a case on pancreatic cancers. So actually a patients which have gone through at least, this is a pancreatic cancer with stage 4 liver metastasis. So patient has gone through 5 sessions of NK cell therapy, and the symptoms before and after treatment was improvement in all the symptoms. Patient has reduced in the tiredness, weakness, improved in their appetites, and also their pain, abdominal pain has also improved, and also patient feel also gain weight. Okay, gain weight because they gain their appetite. So the treatment was a combination with their chemotherapy, okay, and also cyberknife. So the outcome was, after combining with the NK cell therapy, the tumor size was actually reduced, both primary and also the metastatic lesion also reduced. So this is one of studies prove the effectiveness of cancer's treatment using a combination with NK cell therapy. Yeah, and the NK cell itself is actually very safe to be done without any side effects. So basically, it can combine throughout the program or the protocol of the chemotherapy. So it is quite flexible to combine with this kind of therapy if a person is on any particular therapy. Okay. Second case study I would like to share with you is a case on lung cancer. So this lung cancer was also a stage 4 with lymph nodes metastasis. So this patient has did about 7 sessions of NK cells. Before therapy, the symptoms was persistent cough and also general weakness, low appetite, and also pain and nausea, can't eat. And patients just did radiotherapy and chemotherapy. But after combining with this NK cell therapy, all the symptoms improve, resolve, no pain, and also patients start to have more appetite and starting to have reduced in cough. Yeah, so the tumor size decreased from 6 to 2 cm. So, it's a very tremendous reduction. So you see, NK cell in this sense, it improved the cancer's problem and also it improved the health in general for the patient. So the patient improve and heal faster. It respond better. It also can make a person recover faster from all those chemotherapy and radiotherapy. So this is a sense of the usefulness of NK cell combining with chemotherapy or radiotherapy for cancer treatment. Another case is also a cancer case called malignant lymphoma. So this is a case is malignant lymphoma stage 4 with lung metastasis. So did 4 sessions of NK cells. Symptoms before treatment, just using chemotherapy, was persistent infection, generally very weak, low appetite, and also in pain most of the time. After combining with NK cells, patients starting to resolve all the symptoms with lesser pain, starting to gain appetite, and also improve in their overall energy, lesser weakness, and also starting to have less infections episodes. Yeah, the tumor size also decreased from the scanning from 6 cm initially to only 2.5 cm after the combining with NK cells. So you see, this is again and again the study proof. Yeah, so we are so great that NK cell now is like considered a proven treatment. A lot of studies has been using it, and now the technology has fully established and also available now in Malaysia. So it is so something very fantastic and very excited to be shared. So let's see. Okay, and also statistics shows that for example, this is a case study on lung cancer. Study shows that about 164 patients with lung cancers after comparing using chemotherapy or radiotherapy, okay, combining with immunotherapy means NK cell. So those patients with immunotherapy or NK cells combination has at least 2 times higher than uh, those group of patients which just did radiotherapy or chemotherapy, okay, have at least 2 times the sort of like improvement, okay, 2 times the rate of improvement, and also overall well-being, okay, and the survival rate also improve, okay. So you see, by combining this NK cell, it makes a person survive better, survive longer, and also improve faster, okay. So this is a study. Yeah, okay, this is statistics. So after this is primary lung cancer. Okay, lung cancer with after treatment of chemotherapy and radiotherapy, the survival rate, okay, increased at least 20% up to 5 years or 9 years. All right. So you see, these are the great things that I would like to share with every one of you. NK cells, how it is, what is the sort of like role in the body. It is very important because our body really need immune system, and immune system is no more just regarding as infection prevention, but it helps to protect our internal body from cancers development. All right. So especially this technology from Korean, already have FDA approved in Japan. Okay, so they already gain a very good sort of like technology recognition. Okay, and the most important part is their way of cultivation of the NK cell is so far the most established and the best quality. Okay, with best combination of NK and KT cell and best number of cultivation and activation. And importantly is they are fresh, using only your own blood, autologous without any sort of like frozen. We in the lab or in the technology itself, it didn't use any frozen kind of blood. We want to keep the cells as live, as active as possible, so that the function of NK cell will be at the optimum level. Okay. Right, ladies and gentlemen. Okay, if you're interested to know a little bit here, I already on these pictures of flow chart. So how this procedure was done is actually very simple. About 14 day cycles for one procedure. First step is to take your blood, about 70 cc's. Then after that, after the blood will be immediately sent to the lab, and the lab will first extract the immune cells. Yeah, and after that, it will go through activation phase and expansion phase. After all, at about day 10 to 12, it will start to harvest all the safety and QC testing. And when it's ready at the optimum timing, then it will introduce back into our body through intravenous infusion and injection. So this is how it is done. Basically, what you will be experiencing is just a blood taking one session, then after that, another drip session, IV injection. That's all. Okay, the rest is left to the lab, and the lab will cultivate and activate and making sure all the products is in the highest quality to you. Okay, so ladies and gentlemen, okay, this I prepared a little bit of standard protocols that we usually will refer to, but it's not definite protocol. Okay, so for example, if a person looking for anti-aging or for immune booster effect, it is recommended to do the NK cells treatment usually about one times a year, once a year or 2 times per year. Meaning to say, if 2 times a year means 6 months once lah. Yeah. So meaning to say, if you are healthy, you can do only 1 year once. Okay. Why is it so? Okay, first I explain a little bit. NK cell lifespan itself is only 2 weeks in the body. So after we expand and take out the blood, that's why it takes 2 weeks to activate the blood. Before 2 weeks, you must infuse back to the body already. Okay, because or else after you expand, very good. But if you leave over in the lab after 14 days, up to 20 days, it may dies off. Then the quality is not all life. It's no more a live cell. So we want it to be a live cell, most active form. And once you infuse, okay, it will clear off all your unhealthy cells or the damaged or aging cells. Okay, so if you are healthy, you have no much, or you only have certain amount of this unhealthy cell, maybe hidden cancer cells, so it will clear off for you one round, good enough. So if you have very strong family history, probably you need 2 rounds. Okay, yeah, for first time. After that, you maintain once a year will be good enough. Yeah. But let's say for another person who has disease, for example, active disease, okay, either post COVID-19 or post infection, or a person having autoimmune disease like rheumatoid arthritis, psoriasis, SLE, multiple sclerosis, or vitiligo problems. So then the treatment recommendation protocol is roughly recommended 3 sessions or even 1 session, depends on the response, at least 1 to 3 sessions in an interval about 1 month apart. Meaning to say, if you do 1 round, means you take 2 weeks. After the 2 weeks, you wait for 1 month and you repeat another round in 2 weeks. For treatment 2 weeks. So in that sense, you carry on for consecutively 1 to 3 times in that sense. Because why? This disease condition or autoimmune disease problem, it does have a unhealthy condition. So we need slightly more sessions of NK cells to adequately treat the whole problems. Okay, yeah. And for cancer's condition, yes, indeed, it even needs common sense. It needs even more session. It can be going up to even 5 to even 10 sessions in every 1 or 2 weeks interval. Meaning to say, 1 session 2 weeks. After that, you rest 1 week, then you repeat another cycle again in 2 weeks. Then you repeat. So interval between 2 weeks is 1 week in a sense. So you repeat up to 5 or even 10 times. But this is to make or to make the cancers improve at the initial stage. For maintenance or to prevent, you can do it like in once or twice a year. All right. Okay. So it's not like keep on doing. Okay. Yeah. So we just share this information and discussion in one of our local TV in 8TV yesterday, which is 5th of April. 2 to 3 p.m. So I shared it in the Mandarin version in the live show yesterday. So for whoever wants to watch in the Mandarin version, you can always search this Living Delight program, or even click the my assistant just share the link. Okay, you can just click the link or copy the link to your computer or your phone to watch back again on the Living Delight show on yesterday, talking about NK cell exactly, so how it helps, and in the Mandarin version. Okay, so for every one of you who just joined us slightly late in our today's live, if you missed the early portion, so you are welcome to watch back again also on this live after we completed, so that you can catch back the important facts that we just mentioned early on. Okay, so these are the important and something exciting knowledge and also technologies is very beneficial for every one of us, even though you are healthy, no matter you are healthy or aging or you are suffering some diseases. Give yourself a chance to understand this, and if possible, this is a choice of treatment that you can consider to improve your health better. All right, so almost coming to the end. Okay, I will see any questions asked, like Judy Tan. How many cells will get in one culture or one expansion of NK cells? Usually will get almost 500 to 2,000 times of what our own blood has inside. Meaning to say, our own circulating blood has NK cell. let's say I take your blood about 70 cc's. When we send to a labs, they will examine under the machine, examination test, to see how many cells that you have, and the culture and the expansion will be able to achieve at least 500 to 2,000 times of the cells that you have. Yeah, then you infuse back to your body, and you will be able to benefit a higher number of your NK and also NK T cells, and also active form of NK and NK T cell. So this is a crucial thing. Once your body have higher number of NK and NK T cell and also active NK and NK T cell, your cells itself, your NK and NK T cell itself will start working for you. Yeah, you will start. They will start clearing off all the unhealthy cells in your body. You won't feel anything. You don't feel anything at all. Yeah. So, but you will get just healthier and healthier. That's all. Okay. Yeah. So this is what. And just now, if before I miss out, one of the facts that we talk about this NK cell is using autologous, means we use our own blood. We don't use other people's one. So this is completely safe without any chance or risk of rejection. Okay. And secondly is with a good GMP lab, or we call it a good quality lab, and good technology supporting this technology, now we are rest assured that the injected products after the 14 days of culturing in the lab is fully free from any toxins or medications or any chemicals inside. Yeah. And the product itself is also handled in a well care with all the QC to make sure that the cells are all the live cell, so it wouldn't cause a lot of we call it cytokine reaction problems in the body later on. Yeah. So if it is all the dead cells, then it will be likely to cause some cytokine reaction, which you may feel some fever, some sign of rashes after treatment. So with live cell usually, and if it is your own cell, usually definitely it will be very safe. Okay. So this is what criteria of safety that we are ensuring, okay, on using an NK cell treatment for all our patients. Okay. So you are welcome to see and click on the link here to watch back a Mandarin version of NK cell discussion on our yesterday Mandarin show in Living Delight 8 TV. Okay. Yes. So hereby I thank you very much to every one of you. If you would like to discuss about your own problems and also your own relatives problem, for example, or you want to know further information regarding this therapy, welcome every one of you to contact us, okay, and we can do consultations, and also we will analyze for you and also give you a detailed explanation accordingly to your problems one by one. All right. So thank you very much. Yes, I hope every one of you will have. Okay. All right. So May, yes, thank you. Okay, thank you. See you. Okay. Judy Tan, thank you. Yeah. All right. Thank you very much. Thank you, every one of you, for joining our live session today. Yeah, and I wish you a very wish you stay healthy, stay beauty, and also protect yourself from COVID-19. Okay, can consider NK cell. Okay, all right. Thank you. See you again. Bye bye.